talk about targeting BRAF mutations in colorectal cancer. These are my disclosures. So, by way of introduction, this audience is very familiar with the incidence of BRAF mutations in colorectal cancer. And when we consider the entire spectrum, most published data show less than 10% of patients affected, with the vast majority being the V600E mutation. We know that historically they tend to have worse prognosis compared to the wild type or the non V600E abnormalities. Predating the Beacon trial, the median overall survival used to be 11 months and was really the worst out of the different subgroups in colorectal cancer. The current first-line recommendations from the ASCO guidelines is to still proceed with chemotherapy with an anti-VEGF antibody in the first line. And a lot of thinking goes into choosing between a triplet or a doublet based on shared decision-making with the patient, knowing fully well that triplet combinations tend to be associated with more grade 3 or higher side effects, but a lot of published data also suggesting that doublet may not be as effective compared to the triplet regimen. And we learned very quickly that BRAF inhibitor monotherapy, even when combined with MEK inhibitors, really do not have any meaningful clinical benefit, unlike what had been established in the melanoma world. And so adding an EGFR inhibitor was really what overcame the adaptive resistance and led to the current treatment landscape. So the Beacon trial, this audience is very familiar. This was a randomized phase 3 trial that treated patients with either the triplet, MEK inhibitor binimetinib, EGFR inhibitor cetuximab, and the BRAF inhibitor encorafenib. And the second arm had only the doublet, while the control arm was chemotherapy with cetuximab. And the overall survival for the triplet showed the superior overall survivor from the triplet over the control arm. Same thing was shown with the doublet over the control arm. However, the equipoise between the triplet and the doublet arms eventually led to the FDA approving the doublet in the second or subsequent lines of therapy. And the subgroup analysis showed that there really were no significant differences when you consider performance status or the demographic characteristics such as the lines of prior treatment. The doublet was very well tolerated, even compared to chemotherapy. With the most common adverse events being diarrhea, dermatitis, acneiform, nausea, and vomiting. But there have been many other trials that have been published, and this table summarizes some of the more recent ones. Right at the top of the table, published by Dr. Van Kotsem, was a first line, so really leading the charge in bringing this regimen to an earlier line of treatment. And the patients were treated in a single-arm phase 2 study using the triplet, encorafenib, cetuximab, and binimetinib, almost 100 patients with an overall response rate of 47% and a median overall survival of 18.3 months. We have also published the colorectal BRAF targeting cohort from the TAPER study, in which patients were treated with cobimetinib, 60 milligrams daily, 3 weeks on, 1 week off, in combination with vemurafenib, 960 milligrams twice a day. And this table showed the demographic characteristics with the vast majority of patients being treated with 3 or prior lines of treatment. So these were really treatment refractory patient population. And the waterfall plot showed some encouraging decrease in tumor volume. The adverse events were nothing surprising compared to what we had seen with the combination, especially in the melanoma world. And both the swimmer and the spider plot showed some meaningful, durable responses among a subset of the patients. The median PFS and overall survival were very modest, but also reflecting the chemorefractory nature of the patients who were enrolled on that trial. There are some ongoing trials that I'm really excited about, hoping that once we get the result, the treatment landscape will really change. So, for example, the Breakwater, being led by Dr. Kopet, is a first-line randomized phase 3 study of the encorafenib, cetuximab, or the Beacon regimen with chemotherapy, or just the Beacon regimen, and the control arm is going to be chemotherapy with or without bevacizumab. Combining BRAF V600E targeting with immune checkpoint inhibitors is also a very attractive area of research. So, for example, the CMAC is looking at the Beacon regimen and encorafenib with cetuximab with or without pembrolizumab in the mismatch repair deficient population with tumors also harboring the BRAF V600E mutation. And then lastly, the SWOG 2107. This is looking at subsequent lines of treatment, but based on prior very exciting single-arm phase 2 study led by Dr. Van Morris that looked at nivolumab with the Beacon regimen with an overall response rate of 47% and a median overall survivor of 11.4 months. Hopefully, we'll see if this can also translate to that survival advantage in a randomized setting. There are also a lot of targeted therapies either being studied in combination or as monotherapy, especially with the SHIP2, the ULK, WEE1, and then also Merck inhibitors. And finally, I would like to remind everyone of the ongoing Alliance trial that's hoping to translate the survival advantage in the palliative setting to the adjuvant landscape. And so this study is currently enrolling patients with node positive or high risk stage 2 T4 colon cancer. In patients who have already received at least 3 months of adjuvant chemotherapy with BRAF V600E mutation either detected locally or as part of central testing. And the patients will be randomized 1-to-1 to receiving the Beacon regimen and encorafenib with cetuximab for 6 months or the usual care. A lot of translational correlates are also built into this study. And so, as many people have access to this study, please consider enrolling your patients. Finally, BRAF V600E mutation in colorectal cancer is an established therapeutic target with prolonged survival demonstrated from the dual EGFR BRAF blockade. There are so many non-V600E targeting going on, and a lot of the emerging innovative combinations that are also briefly reviewed that appear promising and could lead to improvement in the current landscape. Thank you very much.